Right, good morning again, everyone. I've just been on Instagram Live, but it looks to me like I might have to move this update to Facebook because if you don't save the Instagram video on time, you just lose everything. So, and there's also like a time cap. It looks like Facebook is going to be we're going to be back here on Facebook. Many of you might not know that I'm on here, but again, I'll share the video on my personal page, and then tomorrow you can all join in and you can post questions. It might just be easier this way. So what I've just done on Instagram, which will still be on the story, and I'll try and put it on the highlights, see whether it will save. But what I've just done is I've answered questions that were sent to me over the last 24 hours about the coronavirus, and also just giving some updates as to what's been going on across the world overnight. So I'm just going to do the same thing on here again. Not convenient, but I want to do it again because I don't want to miss the days again. And what I'll just say is that please send all your questions for tomorrow's update, and I'll do my best to answer them. If I don't know, I will ask someone who knows. So if I go with the first question that I was asked from yesterday, which from Yemi says, nice one, Dr. Monica. Donald Trump is prescribing hydroxychloroquine as a cure for the coronavirus despite no trials. Is this one of the reasons why the rate of infection is low in sub-Saharan nations? Well, I don't believe that chloroquine is recognized as a cure as of this time. What I'm aware of is that it's being tried, and the news is that even in China it was tried for some of their patients with good results. And there's no published evidence yet. So my suggestion is that you don't go around going to buy chloroquine because it won't help with mild cases, and it's quite a toxic drug. So it's not worth using that, and it's only being used in very, very, very severe cases. There's no published papers on it yet. Please do not buy it over the counter. Do not use it. You will just do more damage than good to your health. And the next question that was sent to me was, thanks for the updates, Dr. Monica. It's all the news I listen to. I have two questions. You mentioned an app you recommended for someone with for mental health. Please, what is it? Yes, as I was saying, now with the coronavirus pandemic, a lot of people are really, really panicking. It's really scary, particularly when you see how the whole thing is climbing. And if you don't keep your mental health really well this time, people can start to suffer from obsessive compulsive disorder with constant hand washing. People can start to suffer from depression and anxiety. So one of the apps that I mentioned yesterday is called Headspace. I'll type it into the comment box. I'm not endorsing them. I do not have any shares in Headspace, but I know that it's quite a useful app to use to just try and calm oneself down. And if you suffer from any mental health problems, to use that is quite a useful app to use. There are many others like Living Life to the Full. I use a meditation app myself called Insights. There's so many of them. So just use that, because there's no point developing depression or anxiety or sort of bipolar, or just becoming sort of really unwell with mental health problems after the whole pandemic passes, which it will pass. I know it doesn't look like it at the moment, but it will pass. The next question says, I have a habit of scratching my eyes almost all the time. I wash my hands often, but I almost can't stop touching my face. Any remedies for me? Well, if you're scratching your eyes all the time, it might be that you have hay fever. It might be that you have some sort of eye problem. So it's important that you speak to a doctor. You might not be able to see a doctor if you're in the UK right now, but you'll be able to have a telephone or video consultation. But I'm sure in Nigeria and other parts of the world, people are still having face-to-face consultations, although it's not good practice. It's best to do a telephone consultation or a video consultation to just check whether you have any eye problems. So things like blepharitis, conjunctivitis, allergic conjunctivitis, hay fever can cause that. And a simple eye drop will be able to help you, or regular antihistamines will be able to help. I'll take one more question, which says, I need you to share insight on the correlation between optimum nutrition and immunity. Yes, your immune system is bolstered by eating well. We know that a low-fat diet, People recommend a Mediterranean diet as well. Lots of nuts, lots of berries, staying away from refined sugars, staying away from anything that is, refined oils. So anything that's been sort of changed in its form is what is refined. So cakes and donuts and any of that, maybe not a good idea. But again, everything in moderation. And if you hydrate well, I always say 1.5 to 2 liters of water a day. You get out into some fresh air. So exercise, try and get your heart rate up. All of that builds immunity as well. It doesn't mean you're not going to get disease. It doesn't mean you're not going to get ill. It just means that if you do get all of those things, you are more likely able to fight it. Nothing is promised, as I always say. Doctors don't have the answers to everything. All you can do is do your best, and then you leave the rest. Anyway, I'll just quickly finish up with what's been going on since yesterday. Obviously, in the UK, the death toll has increased a bit more overnight. We're having a few more people on ventilation, or a lot more people on ventilation actually. So the whole idea of the quarantine and social, just isolating, social distancing is very, very important. Maybe not for yourself personally because you feel like you're healthy, but definitely for other people, it's important that you don't be a carrier. Don't be Typhoid Mary. If anybody has heard of Typhoid Mary, who's just spreading the illness and people are getting really ill. So remember to just follow the instructions that have been given. It won't go on forever. And the more we do it, the less people are likely to get it. In Nigeria, the cases are up to 12. Quite a lot of schools, they've shut down public and private schools. And I think the measures that are being taken are the right ones to take at this point. Try and obey as much as you can. And that will be helpful for everybody. Remember to stay off the news. I think the news is driving people crazy. This 24-hour news and this whole scaremongering, panic buying, people are terrified. Their mental health is in tatters. I fast from my phone and from the news for at least 10 to 12 hours a day. Don't let the news drive you crazy. Keep your mental health safe. Try and talk to people around you. Text, call, reach out to them if you can. You don't know what they're dealing with. They haven't reached out to you. There might be some personal challenges that they're going through. So reach out to them, check how they're doing, and you might be surprised that you might just be a lifeline for somebody else. So I think I'll transfer this live updates to Facebook now because Instagram just feels a little bit too complicated. So we'll do it on Facebook. If you have any questions, please maybe put it in the comments box, tweet it to me, send it to me on Instagram. Just make sure you just put it on, say Ask Vine Health, and I'll know that it's a question for me. And then tomorrow I'll be back here again. It might be a different time because it's a weekend, maybe much earlier, I don't know. But whatever the case is, I'll share it. If you have any tips, if you're a nurse, a doctor, a pharmacist, or somebody who's just really into healthcare or who just knows stuff, please just post any tips in the comments as well, and I'll discuss it as well tomorrow. Thank you so much, everyone that's tuned in this morning. Please share this video when it's done. Invite people to listen and to contribute tomorrow as well, and I'll be really grateful. Thank you, and have a great day. Stay safe, look after yourself.